Time now for some important medical information. June is Hernia Awareness Month, and here to tell us more about prevention and treatments is Dr. Giacomo Mica from the Surgical Clinic. Nice to have you with us today.
Hi, thank you for having me.
So we've heard of hernias, but I don't know that everybody really knows exactly what they are.
Sure. So the abdominal wall has several layers of tissue. The most superficial layer is skin, below that is fat, and then below that is dense connective tissue called fascia. And that layer actually is the strength layer of the abdominal wall, and that keeps all of your organs within your abdominal cavity. When you get a tear in the fascia, essentially you can have those organs come out through the abdominal cavity into those more superficial layers.
Okay.
And so that essentially is a hernia.
All right. So how would you know if you had a hernia? What would be some of the symptoms?
Most often people complain of a bulge or a mass in their abdomen that they didn't notice before. Oftentimes people are out in the garden working, they're lifting, they're doing stuff in the summertime, and they notice that they have bulges. They may notice pain often where they have that bulge. They can have nausea. And then occasionally people can actually have vomiting from having a hernia as well. Yeah.
Hernias can occur in different places in the body. Where do we find hernias?
Absolutely. The most common locations for hernias are at the belly button, which is called an umbilical hernia. Mm-hmm. And then also we have hernias in the lower abdomen, in the groin. It's called an inguinal hernia. And then anybody who's had surgery on their abdomen can actually have hernias at the location of the incisions of their hernia, and that's called an incisional hernia.
Oh, okay. So there are lots of different varieties then.
There are lots of different varieties. Those are just really the most common ones.
All right. We can prevent hernias, not all of them obviously, but there are some risk factors that we can avoid then to help us have the best chance of not getting a hernia.
Yeah, that's correct. So staying healthy, being active, staying strong, avoiding obesity, avoiding smoking, alcohol. Those are really the biggest risk factors for hernias, and you can modify those risks by essentially trying to live a healthy life, have a healthy diet.
Okay. If you find that you do have a hernia, how is it treated?
We treat hernias surgically. So there's two main ways of repairing a hernia. You can do it through an open incision, which is really kind of historically how we repaired them, with a big incision. Go in there, repair the defect, sometimes put mesh, sometimes don't put mesh. I think we've moved more toward laparoscopic surgery, where we actually just use very small incisions. We're able to go in the abdomen, fill it up with air, put a camera in there, and repair the hernia from the inside with mesh.
Recovery time?
It depends on how you have it repaired. So open surgery, recovery tends to be, several days. People have pain. You're at higher risk for infection and recurrence. With laparoscopic surgery, people usually recover much quicker. They usually don't have to be in the hospital to have it repaired. And it's still, people are going to have some pain, but chances of infection and things like that are reduced.
All right, some good information. Thank you, Dr. Mica.
Thank you very much.
Appreciate you being with us. The Surgical Clinic has locations in Dixon and Fairview. You'll find all the contact information online on our website.